It's a telling statistic that seemingly paints a grim picture. Kenya ranks 10th on the list of the highest tuberculosis population in the world. And while considerable gains are being made in the fight against TB, there arguably emerges a hurdle, that of stigmatization. It's a territory that Daniel Ngetich guards jealously, his farm in Iruru village, Kapsabet. This is the making of a man who, together with his former cellmate, Patrick Ngetich, can now enjoy the liberties that come with sweet freedom. But 7 months on and time has done little to erase memories of a 2-month jail term that could easily have been 8 months were it not for an outcry from human rights groups.
Eleza jinsi ya masharti ya hiyo tao, lakini niliona walifanya vibaya kutumia nguvu kunyanyasa sisi.
Ukiamuka asubuhi usipokula vizuri jioni, unaweza anguka, unaweza shindwa hata kufalo.
This medication is what Henry Ngetich was on. For the 2 months he was hospitalized after being arrested, a course of treatment that typically takes 6 months. But incarceration has done little to control the spread of TB in a village that faces a constant reminder of an ordeal that has left many of them fearing for the worst, the possibility of new infections.
Hasa kwa hiyo yetu ndio watu ni wengi na inakaa watu ni wako na ugonjwa na inatakana watibiwe lakini wako na uoga.
His sentiments precisely what residents here would rather ignore or not speak about altogether, unless in hushed tones. But for those who do speak out,
tunaona eri madaktari yaende kila nyumba kwa imara na eleze watu vile wanakula dawa.
These patients were defaulting because they didn't have the appropriate education. They didn't understand. They only understood that you are given this medicine for 3 months. After that, you are cured. Now you don't need any other treatment. But they didn't know after taking treatment for these 3 months, you go back to the hospital.
It is ultimately what has caused a raging debate over where best to place TB patients found flouting the Public Health Act that allows for, quote, in part, isolation of persons exposed to infection of any infectious diseases, unquote.
We are also seeking that the court should make a declaration that a prison is not the contemplated place of isolation in the case of persons who have defaulted from their TB treatment while they have been infectious. This is also in line with the international instruments that Kenya has signed and are now applicable in this particular country. In most cases, the chosen place of isolation has always been a medical facility.
And therein lies one of the challenges in the fight against TB. The other side of the coin is, however, representative of the imminent danger posed by patients who either knowingly or unknowingly fail to take their medication as prescribed, owing to the fact that TB is contagious. Salim Bilu, Citizen Live at 9.